So Dr. David, my buddy, we want you to kick off this program and look backwards, but also talk about what's going on. Dr. YadinD David.
Absolutely, Tom. Thank you very much for this opportunity and to join this distinguished faculty today. You're going to be hearing from so many experts about what happened over the last year and a half that is interesting and a reason to celebrate our profession. It was challenging, it was hard, but we continue to provide expertise and we continue to search for knowledge. So we started in April 9, 2020 with our first webinar that was a result of realization that there is a lack of opportunity to seek new knowledge and to deal with this pandemic. Everything in our life suddenly changed. The way we socialize, the way we learn, the way we travel, the way we shop, the way our hospitals are operating, and the priority of services, the role of technology, especially in the airway management and oxygen administration. Everything changed. New company, new vendor, new devices, and we didn't know how to deal with all that. We didn't know how to get supplies. We didn't understand how to keep safe environment. And it was in March of 2020. I think it's in the next slide, if I'm not wrong. Caliroy? No. Okay. In the era of March 2020, we got an urgent request for assistance from WHO that are telling us we have this tremendously kind donation from China of 1,000 ventilators. We have no idea who are the vendors. We have no idea what the control are saying. It's in Chinese, and what's the expertise that is needed in order to put them into service. Can you help us? We turned to China. Zheng Kun is on the line here, Li Bin on the line, Jin Dong did not attend today, but they all turned immediately. And over a weekend, we got 179 clinical engineering responses of experience with 5 different brands of ventilators that China was donating, with specific grading and confirmation of specification. And we realized that what we have just done was the opportunity to get together in a new format, and that the world is needing more rapid source of information. So we decided to start this webinar series, of which we selected 8 highlights today, 8 topics as highlights today, to celebrate our overcoming the challenge, providing the services, and continue to be the experts in health technology management and clinical engineering wherever you are around the world. We asked in April 2020 that not only we can start the webinar, but also we started with Elliot Sloan, who is on the line, Rosanna Reeves, and Tom Judd, and Kali Roy, Stravanos, who was online, a daily vetting of general information relating to COVID-19 about how clinicians are working, how social workers are helping, how psychiatrists is dealing with the new social challenges. And we put together a daily vetting of literature in order to bring this information, and it's available to you and you can visit it. And every day we select papers that were peer reviews and addressing different issues, including technology and engineering relating to COVID-19. In April 2020, we asked 3 questions. Right now, what are the challenges you're facing? And since then, we're asking, what are the lessons we have learned? Next. We have received responses from different parts of the world, like this is the one that came from China, how to build hospital and how to fit medical equipment into an isolation wards. Next. We received the responses from the Italian Association of Clinical Engineering, talking about how can we get an inventory detail on a nation level to understand where are the oxygen concentrator, where are the mechanical ventilator, and what are the organizational issues, and how can we obtain new supply somewhere. Next. We also received from Riyad Farah from Lebanon, his opinion about what is needed, a national plan, an architectural readiness for rapidly changing spaces. Next. And from Mexico City, Roberto Ayala, who is going to be speaking later on the subject, has his view from the public hospital services in Mexico. Next. Doug Dreps from the St. Louis area that is highly concerned about how to protect data and how to make sure that as we move ventilators around, we understand how to deal with services and clean the environment. Next. And finally from Brazil, and I think that we have one more from Colombia. Do we have one more from Colombia? No. We learned from Brazil that although they have dealt with infectious disease before, this was a uniquely new environment. And how to prepare for this, the Brazilians suggested we need to understand disaster preparedness overall. And if we are practicing and having a plan to deal with disaster, then the outcome should be more predictable and better to patient care experiences. Next. So in general, we overcame a great challenges. We have all the reason to celebrate today, and we're going to hear for the rest of the webinar how our world has changed in the clinical engineering arena and how did we make sure that we are prepared for the new future. Thank you. Back to you, Tom.
Thank you, Yadin.